Dignity, security and a prosperous future. With a healthy life. It's all possible with just wise decisions. Adamjee Insurance introduced micro health insurance in 2005. It was the first time that a health insurance policy for the vulnerable and deprived people of our society living below the poverty line was introduced in Pakistan. These people were compelled to pass their lives without basic healthcare amenities. Barely able to earn 200 to 300 rupees a day, they were unable to pay hospital charges for their healthcare. The sufferings of their families were apparent in the case of their illness, accidental death and disability. Suddenly one day, an accident occurred. On reaching the hospital, there was a state of confusion and chaos. Maula Baksh and Murad's father were badly hurt in the accident. Due to insufficient modern healthcare facilities in government hospitals, Amina, without worrying for any funds, arranged the shifting of her father to a private hospital on the panel of Adamjee Insurance. While Murad's mother went to the Chaudhry of the village to borrow money for the operation,
Sunil was a grocery shopkeeper who used to go to Nagar Parkar after every 15 days to purchase goods and sell these goods here in the village. It was a year ago when Sunil was on his way to Nagar Parkar and the vehicle he was travelling on developed a fault and stopped in the middle. Sunil had 10,000 rupees with him at that time. The fault in the vehicle could not be ascertained even after 3-4 hours. While the drinking water finished, most of the commuters dispersed here and there in search of water, as was Sunil, who was also dying of thirst. After walking a few miles, he found a well, but before he reached the well, he was bitten by a poisonous snake and died. After his death, life became tough for Lakshmi. Lakshmi's husband was among those level-headed people who thought of the safe future ahead. So he had already acquired Adamjee Micro Health Insurance so that Lakshmi could get help in case of any untoward situation.
But this trend didn't stop right there. On June 20th, 2009, Adamjee Insurance introduced one of the world's most advanced systems of magnetic catch card to make the medical expenses of its poor friends cashless.
अगर आप मुनज़्ज़म नहीं होते, आप अगर अपनी तंजीम नहीं बनाते, तो ना कोई इंश्योरेंस कंपनी आ सकती थी, ना और कोई इदारा आपकी मदद कर सकता था। और मैं उम्मीद करता हूं कि ये जो आपने शुरुआत की है, पूरा पाकिस्तान जो है आपकी तकलीद करेगा।
With the unremitting and untiring efforts of Adamjee and NRSP, TRDP, SRSO and other RSPs, not only is health insurance being provided to the poor living in remote areas, but a range of panel hospitals has also been set up. At Adamjee's panel hospitals, deprived people of the society receive basic and modern healthcare facilities like medicines, operation theatres, specialist doctors and laboratories equipped with modern instruments. This program in the short span of 5 years has transformed the health infrastructure in 90 districts of Pakistan. Moreover, it has encouraged provincial governments to adopt this program for providing basic healthcare for people living below the poverty line.